Good afternoon. Going to get the Medicare webinar started. Good afternoon. We'll get started in just a minute, letting some people in. Hopefully you guys can see my screen. Okay, I'm going to go ahead and get started because we have a ton of information to cover, and I'm going to do my best to keep it under, I'm going to aim for 30 minutes. So I'm going to have to talk really fast. It might go 40 minutes, but for those of you who don't know me, my name is Christine Glazeman, and I'm affiliated with two local companies here in Greater Sacramento area. Local-owned women-owned small business insurance agency owner in Placerville, California. I've been licensed since 2008, and I need to update this, have more than 13,000 hours of experience with Medicare health insurance plans. And I am passionate about educating seniors on all their Medicare plan options so they can make the best decision for their coverage needs. So we have a pretty ambitious agenda here. We're going to go over Medicare Basics, Medicare Eligibility, Enrollment, and avoiding late enrollment penalties. We're going to have a little introduction to Medicare coverage options. We're going to go over original Medicare Part A and B, Medicare Supplement insurance, or also known as Medigap policies, prescription drug coverage, also known as Part D, and Medicare Advantage plans, also known as Part C, and Medicare Open Enrollment. So health insurance for people who are 65 and older, this is what is Medicare, under age 65 with certain disabilities, people with ALS, and any age with end-stage renal disease. To get Medicare, you must be a U.S. citizen or lawfully present in the U.S., must reside in the U.S. for 5 continuous years. So there's 4 parts to Medicare, and throughout this training, we're going to have some different icons that will show up. We have original Medicare with A and B. We have A and B plus Part B, also known as Medicare Advantage, and also Part D, Medicare prescription drug coverage. So when people first become eligible for Medicare, they really just have 2 options. It's nice there's only 2. The first option is original Medicare A and B, and you have the option of adding Part D, and you can also add a Medicare Supplement insurance plan or Medigap.
Christine?
Yes.
Your slides are not advancing.
Oh, they're not. Oh no. There might be.
Thank you. I thought I was the only one.
Oh no.
I still see the first screen.
Oh no. All right.
Maybe it's the internet connection. Oh, now I see it. A change.
Oh, you saw a change?
On the side, not in the front. Not in the main window.
Yeah, I can see you moving your cursor now.
Okay, went back to the beginning.
Yep.
You see the agenda screen?
No,
just the first slide.
One.
Oh no. Oh my goodness.
I wonder if it's the internet connection.
Yeah, it could be.
You can keep going. We just might not be able to see the slide you're on.
And this is also recorded, so I'm going to post this. And I'll share it. So you guys can go back. Hopefully it records with me changing slides. So, okay. How is Medicare funded? In case you were curious, there's 2 different trust funds. One is funded through payroll taxes paid by most employees, employers, and people who are self-employed. Income taxes paid on Social Security benefits, interest earned in the trust fund investments, and Medicare Part A premiums for people who are not eligible for premium-free Part A. And it's also funded through the supplemental Medicare Medical Insurance Trust Fund, funds authorized by Congress, Part B premiums, and Part D premiums. So what agencies are responsible for Medicare? Social Security mostly handles enrollment and premiums. Also, not many people know the Railroad Retirement Board and federal retires premiums are handled by the Office of Personnel Management. All the rest is handled by CMS, Centers for Medicare and Medicaid. How and when you can enroll in Medicare? If you get Social Security disability insurance, Social Security retirement benefits, or railroad retirement benefits, Medicare enrollment and rules decisions vary depending on your age, your other coverage, like from an employer, or if you have end-stage renal disease. Why enrolling on time is important. If you don't enroll on time, costs could be higher. There are late enrollment penalties for A, B, and D, and you could end up paying more for Medicare supplement insurance or Medigap policy. Coverage might be affected, like having a gap in coverage or a waiting period for a pre-existing condition. That is for Medigap plans. And you may not be able to buy a Medigap policy, or you may have to pay more. There is a reason why that is mentioned twice, is because not many people know that if they go past their initial enrollment period, they enroll as a late enrollee, they may not be eligible to purchase a Medicare supplement plan. Premium Part A late enrollment penalty lasts 2 times the number of years you could have had Part A but did not. Part B and D late enrollment penalties last the entire lifetime. There is automatic enrollment for those who get Social Security benefits or railroad retirement benefits. That initial enrollment period package is mailed 3 months before someone turns 65 or the 25th month of disability, and that includes your Medicare cards. And people are enrolled automatically if they are under 65 and disabled and have been entitled to SSDI benefits for 24 months. If they have ALS, Medicare begins the first month entitled to SSDI. And if you are not automatically enrolled in A and B, that is, you're not taking Social Security or railroad retirement benefits 4 months before you turn 65, you do need to enroll in Medicare through Social Security. A couple different ways to do that. You can visit socialsecurity.gov. I know we have the Social Security phone numbers for like the main Social Security office, but I always recommend that people reach out to their local Social Security office. And if they would like some hand holding with that process, applying for their Part A and or Part B, then I usually recommend they make an appointment with them. They can also, I've heard they'll do phone appointments where they will actually walk someone through enrolling on the socialsecurity.gov website. So that makes it convenient too. So there are 3 different periods for signing up for Medicare. There is an initial enrollment period. We refer to that as an IEP. There is a special enrollment period, also known as an SEP, and there is the general enrollment period, or the GEP. So the initial enrollment period, during this time, people can enroll or join Part A, Part B. They can enroll in a Medicare Advantage or Part C plan if they have Part A. Once they have their Part A and B, they can also enroll in Part D, the prescription drug plan, and a Medigap policy as well. And Medigap open enrollment lasts 6 months from when you are both 65 and have Part B. And there are no late enrollment penalties associated with this time frame. I do recommend for most people, though, that they know they're ready to enroll in A and B, that they actually get that done before they turn 65 so that it goes effective their birthday month. It's just easier. There's a little note on my slide here. Hopefully you can see it, but if not, it says that in the 3 months after someone's turned 65, if they're applying for A and B, it could be delayed by 2 to 3 months. And so it's just better to avoid. If you want to get everything to all sync up on the same month, it's easiest to aim for that birthday month of age 65. So that usually means people want to apply for their A and B about 3 months before their 65th birthday. Now there's another enrollment period called an SEP, and this applies a lot to people who have continued to work past age 65. When they do opt to retire and they're coming off of a group health plan, they are going to be given an SEP, special enrollment period. And that is an 8-month period where you can enroll in A and B, and also Medicare Advantage and Part D. And I have a little note here on my slide again. It's best to not delay enrolling any Medigap policy if you want your Part D plan to go effective the same month as Medigap. If you opt to remain on your employer's plan past age 65, this is another super important point. This is worth much more than the price of admission. You will want to obtain a certificate of creditable coverage from your insurance carrier. This will help you avoid late enrollment penalties. Now, nobody knows this. Most HR people don't even know that not all group health coverage is considered Medicare creditable. What that means is it's considered as good or better as original Medicare. If Medicare deems it's not creditable, then some of these people who are retiring and they didn't know, they can be subject to late enrollment penalties. Major bummer. And the employer is technically supposed to supply people who are over age 65 with that certificate of creditable coverage, but many HR people, many business owners, they don't know this. So now you know something that nobody else knows, but it's really important. Okay, the general enrollment period is a 3-month period each year during which people can enroll, join Part A and B. And it lasts from January 1st until March 31st. Coverage begins July 1st. And if you enroll in Medicare during the general enrollment period, you can sign up for Medicare Advantage. You can sign up for Part D. However, and there's a little star down here, Medicare Supplement plans may have a higher premium, or you may not be able to enroll in one at this time. And there also may be late enrollment penalties for Part A, B, and D. So the general enrollment period really is for anyone who has missed their IEP and that they do not have an SEP and they have to, but they need Medicare. So this is kind of their last chance, is the general enrollment period. Enrolling in Medicare Part A and B because you have end-stage renal disease, you need to get a doctor dialysis center to complete a form at CMS 2728, and then they enroll at the Social Security office. Medicare and end-stage renal disease, people can usually get original Medicare. They can join an end-stage renal disease special needs plan, also known as an SNP, if one is available in your area. Unfortunately, they are not eligible for Medigap plans or Medicare Supplement, but effective January 1, 2021, people with end-stage renal disease can join a Medicare Advantage plan with no restrictions. This is what the Medicare health insurance card looks like. It's red, white, and blue. It has an ID number. It has hospital Part A and B coverage dates. If people need a replacement card, they can sign into their mymedicare.gov account and print off an official copy or call Medicare. And it's just 1-800-Medicare. So original Medicare, Part A and B. So Part A includes your hospital insurance, and Part B is all of your outpatient services. And I usually say the easiest way to remember this is Part A is all the services you'd receive inside of a hospital and skilled nursing. Part B is everything outside of a hospital. So doctor office visits, labs, physical therapy, outpatient surgery, everything outside the hospital. If you want drug coverage, you can also join a Part D plan. So to help pay your out-of-pocket costs in original Medicare, like your deductible and 20% coinsurance, you can also shop for and buy supplemental coverage. So a little more detail about Part A. Inpatient care in a hospital includes semi-private rooms, meals, general nursing, other hospital services and supplies. Let's say surgery is also included in there. Inpatient skilled nursing facility care after a 3-day inpatient hospital stay, if you meet all the criteria. So Part A helps cover blood on an inpatient basis, home health care, hospice covered. What is not covered under Part A is private duty nursing, private room, television, phone in your room, personal care items. Most people don't pay for Part A as long as you paid FICA taxes for at least 10 years. If people have paid less FICA taxes less than 10 years, they can pay a monthly premium to get Part A. And they may have a penalty if they do not enroll when first eligible for Part A, if they have to buy it. Monthly premium may go up 10%, and you'll have to pay the higher premium for twice the number of years you could have had Part A but did not sign up. So Part A deductible and coinsurance amounts for the calendar years 2021 and 2022. Did want to make a note, if you would like a copy of these slides, I'm happy to share that with you. Just send me a message or an email. But we have, the cost did go up a little bit for 22. They actually do go up a little bit each year. So for original Medicare Part A, there is an inpatient hospital deductible of $1,556. There is daily coinsurance for days 61 through 90 of $389 per day. There is a daily coinsurance for lifetime reserve days of $778 per day. And there is skilled nursing facility coinsurance for $194.50 per day. And that skilled nursing facility coinsurance, I can tell you off the top of my head, it goes from days 21 all the way up through 100. Medicare does not pay anything for skilled nursing beyond 100 days. Benefit periods in original Medicare. This is something that most people don't know about. It's a little different. We're used to calendar years when we're looking at deductibles and coinsurance. However, it's different for Part A. For Part A, they have benefit periods of 60 days. So a benefit period will begin the first day someone gets inpatient care in a hospital, and it ends when someone is not in a hospital or skilled nursing for 60 days in a row. What does that mean? So that means that you probably already figured it out. Someone can actually end up paying that Part A deductible twice in 1 year. That is, if they go back into the hospital within the same year. It's not a calendar year deductible, which is why a lot of people look at Medicare Advantage and Medicare Supplements for containing those costs. And so as I have right there in our notes, there's no limit to the number of benefit periods you can have, and benefit periods can span across calendar years. So home health care coverage includes intermittent skilled nursing care, physical therapy, speech, language pathology services, continued occupational services, and more. But Medicare does not pay for 24-hour-a-day care at home, does not pay for meals delivered to your home, homemaker services, personal care. So, decision, do I need to sign up for Part A? Consider it's free for most people, and you can buy it if your work history is not sufficient. There may be a penalty if you delay. You want to talk to your benefits administrator if you or your spouse are still working and covered by an employer plan. And I have something on my slide here in really big letters. This is super important. You want to stop contributions to your health savings account, your HSA, before your Medicare starts to avoid Internal Revenue Service tax penalties. Another really important note, it's not on the slides, but I have heard that a lot of HSA type of plans are not considered creditable by Medicare. So people who are on those type of plans and they are going to continue to work past age 65, first thing they need to do is stop contributions. I've heard 3 months before Medicare goes effective, but also they are going to want to, if they're going to continue to work past 65, they're going to want to change to a different type of plan, a non-HSA. Okay, we're going to talk about Part B. Medical insurance helps cover medically necessary doctor services, outpatient medical surgical services and supplies, clinical labs, durable medical equipment, diabetic testing equipment and supplies, preventative services, home health care, medically necessary outpatient physical occupational therapy, speech therapy, outpatient mental health care services. There is a monthly premium for Part B. The standard premium in 2022 was $170.10. And some people may have to pay a higher amount depending on their income. That's in the next slide. Some people who get Social Security benefits may pay less than this amount. So this is a really helpful chart for people who have higher incomes so that they can plan what their Part B premium is going to be. Again, the standard premium is $170, but people who earn more are going to be paying more. And I'm happy to share if you only want this slide or the Part D IRMA chart, I can also share that with you too. You just ask me, just send me an email and let me know if you'd like it. So Part B, what you'll pay in original Medicare, the monthly premium is $233. There is 20% coinsurance for most covered services, 0 preventive, 20% for outpatient mental health, and co-payments for hospital outpatient services. So you want to consider, most people pay monthly premium for Part B. It's usually deducted from Social Security. Many people opt for that. The amount depends on income. It may supplement employer income. Definitely want to contact your benefits administrator to understand the impact to your employer plan. If you do not have other coverage, declining Part B will mean that you don't have full coverage. There are some cases when you need to have Part B, and that is if you want to buy a Medigap or Medicare Supplement policy, if you would like to join a Medicare Advantage plan, if you're eligible for TRICARE or VA, or if your employer coverage requires you to have it. That is the employer, small group employers less than 20 employees. You definitely want to talk to your employer or union benefits administrator. Little note here below for VA. Benefits are separate from Medicare. With VA benefits, you may choose not to enroll in Part B, but you'll pay a penalty if you don't sign up for Part B during your initial enrollment period and enroll later. If you have VA coverage, you will not be eligible to enroll in Part B using the special enrollment period. So what is not covered by Part A and B? Most dental care, eye exams related to prescribing glasses, so optometry, dentures, cosmetic surgery, routine physical exams, massage therapy, acupuncture, hearing aids, long-term care, concierge care, that is boutique medicine. They may be covered if you have other coverage like Medicaid or Medicare Advantage plan that covers these services. Some Medicare Advantage plans will throw in some benefits for dental and vision. Medicare Supplement insurance is sold by private insurance companies. It fills in the gaps for original Medicare coverage. One important thing I didn't note on the Part B, that 20% coinsurance, that is for all Part B services. There is no cap on that. So that's another reason why people they do consider and enroll in Medigap plans or Medicare Advantage plan, because that's a way to contain that 20%, at least on the Part B side, as well as offset those deductibles and coinsurance under Part A. So all plans with the same letter of Medicare Supplement have the same coverage. Costs are different between insurance carriers. Medigap plans work with any provider who accepts Medicare, and many plans work nationwide. This is one of the, I'm going to start to talk a little bit about the differences between Medigap, Medicare Supplement, and Medicare Advantage plans. Typically, Medicare Advantage plans have a doctor network that you do need to stay within. But one of the biggest differences, your Medigap plans have an enormous network, if you will. People can see any provider who accepts Medicare, and most of them do work nationwide, as opposed to most Medicare Advantage plans have a service area that they are limited to. And most coverage outside of the service area is only limited to emergencies. So a little more about Medigap. They are standardized plans identified by a letter. Plans with the same letter must offer all the same benefits. Companies don't have to sell all plans. What's the difference between the insurance carriers? Well, the pricing, monthly premiums could be a little different. The premium rate increase history over time, value-added benefits, Medicare Supplement, insurance carriers will often throw in gym memberships, discount dental and vision, things like that. Plans that are currently sold are A, B, C, D, F, G, K, L, M, and N. Plans that exist but are no longer sold are E, H, I, and J. So this is a really high level look at Medigap plans, and it looks a little different what you may be used to looking at. It's not showing you what someone would pay for going to see your primary care or a copayment for an outpatient surgery. But it's broken down by the Part A and B benefits. And just a quick little overview for some of the more popular plans. The Plan G pays 100% of covered services after you meet your calendar year Part B deductible of $233. It's the only Medicare supplement that covers the Part B excess charges. For plans K and L, after you meet your out-of-pocket yearly limit and the Part B deductible, then the Medigap plan pays 100% of covered services for the rest of the year. Plan N pays 100% of the Part B coinsurance after the Part B deductible. And then there are copays for office visits and emergency room visits, $20 for office visits, $50 for emergency room visits that don't result in an inpatient admission. So when is the best time to buy a Medigap policy? So you want to consider your Medigap open enrollment period begins the month you're 65 or older and enrolled in Part B, can last 6 months minimum, maybe longer in your state. You do have protections during your Medigap open enrollment period. Companies cannot refuse to sell any Medigap policy they offer. They cannot make you wait for coverage. And they cannot charge more because of a past or present health condition. You can also buy a Medigap policy whenever a company agrees to sell you one. If later there may be restrictions, and I have a couple asterisks down at the bottom here. Once that open enrollment window closes, you may not be able to enroll in a Medigap plan in the future. So when someone is first eligible for Part B, that is the time when you want to evaluate if that is the best coverage for your needs. Okay, there were some changes for 2020 on or after January 1st. No standard Medigap plan may provide coverage of the Part B deductible. So what that means is that insurance companies cannot sell standardized Plan C, C for Charlie, F for Frank, to people newly eligible for Medicare. Turning 65 as of January 1st, 2020 or later, getting premium-free Part A as of January 1st, 2020 or later. Person who is not newly eligible for Medicare on January 1st, 2020 or later can buy Plan C or F, but this does not qualify as a guaranteed issue right to buy it. And insurance carriers may sell Plan C or F for those getting Medicare retroactively with the Part A start date before January 1st, 2020. Most people at this time, 2022, are enrolling in Plan G, which is the closest one to Plan F. All right, Medicare prescription drug coverage. The easiest way to remember this is Part D, D for drugs. It's an optional benefit available to all people with Medicare, run by private companies that contract with Medicare. And it is also, Part D is wrapped into many Medicare Advantage plans and some other Medicare health plans. And the costs are going to vary by plan. Most people in 2022 will pay monthly premium, and that varies very much so by plan and income. Very often there is a yearly deductible. There is copayments and coinsurance for refills. There's a percentage of cost while in the coverage gap beginning at $4,430. I'm not going to go over in detail what the coverage gap is, but it's also known as the donut hole. And that is kind of the first stage of the donut hole is when the total costs reach $4,430. People exit the donut hole or the coverage gap after spending is $7,050, and people automatically then get catastrophic coverage. This is an important chart. This is the income-related monthly adjustment amount, the IRMA chart for 2022. Again, there is a surcharge for people with higher incomes for the Medicare Part D prescription drug plans. How Medicare Part D works, it is optional. You can choose a plan and join. Unfortunately, there are lifetime penalties if people join late. The plans have formularies. There's lists of covered drugs, and they must include a range of drugs in each category. They are subject to change, and you will be notified if there are changes. People's out-of-pocket costs may be lower if you use a preferred pharmacy as opposed to a standard pharmacy. If you have limited income and resources, there is an extra help program to help pay Part D costs. So you must have Medicare Part A and or B to join a Medicare prescription drug plan. And you must have Part A and B to join a Medicare Advantage plan. And you must live in the plan's service area. You cannot be incarcerated. You can't be unlawfully present in the US. You cannot live outside the US. And you must join a plan to get drug coverage in most cases. You may have to pay more if you wait to enroll on Part D. Exceptions are if you have creditable drug coverage, that is like someone who's stayed on an employer plan. If people qualify for extra help, many times they do not. They're not subject to late enrollment penalties. But the penalty is 1% for each month eligible without creditable prescription drug coverage. That is, multiply that percentage by the base beneficiary premium. That base premium is $33.37 in 2022, and this amount changes each year. Plans have formularies, that's lists of covered drugs. You always want to make sure that the prescriptions that you need are covered by the plan. And do you have access to a preferred pharmacy? Is there one in your area? You can choose a plan and join. There is a lifetime penalty if you join later and did not have creditable coverage. Now here's an important thing. If someone goes for longer than 63 days without what is deemed as creditable drug coverage, that is when the penalty kicks in. Remember when we had those slides earlier about you do have actually a long time. I think it was like 8 months, 6 or 8 months for the Medigap open enrollment period. Well, you never want to wait that long, because if someone's in a special enrollment period, if they want their Medicare drug plan and their Medigap plan go effective the same month, then I say, let's aim for like the month that the group health plan stops, that the Medicare, everything syncs up for that next month. So that's another reason here for not waiting. Costs can vary by plan. There's extra help to pay Part D costs if you have limited income and resources. Medicare Advantage plan. Bear with me, we're almost done here. Medicare Advantage plan, like a health maintenance organization, an HMO, or a preferred provider organization, PPO, is another way to get your Medicare coverage. It's sometimes called Part C or MA plans. And they are offered by Medicare-approved private companies that must follow rules set by Medicare. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A and B coverage from the MA plan, not original Medicare. And you will need to use the health providers to participate in the plan's network. There are some plans that do offer out-of-network coverage. And as I mentioned before, usually with HMO plans, only emergencies are covered out of the service area. PPO Medicare Advantage plans do offer out-of-network coverage, but the cost shares will definitely be more than for in-network providers. So plans are going to include Part A, B, most plans include Part D, and some plans also include lower out-of-pocket costs and extra benefits. In a Medicare Advantage plan, you're still in Medicare with all the rights and protections. You still get those services covered by A and B. You may choose a plan that includes prescription drug coverage. You can be charged different out-of-pocket costs. Different plans have different cost shares for the services. You cannot be charged more, though, than original Medicare for certain services like chemotherapy, dialysis, skilled nursing, unless you see an out-of-network provider on a PPO Medicare Advantage plan. And you may choose a plan with extra benefits like vision, dental, fitness, or wellness benefits. I want to share a really important note. It's not in my notes here about PPO Medicare Advantage plans. Many people don't know this, but it's different for the under 65 market. When people have PPO plans, it's pretty seamless when they see when they go in and out of network. However, if someone goes out of network on a PPO Medicare Advantage plan, it's very likely they are going to have to pay for that service upfront and then get reimbursed by the Medicare Advantage plan. Many people don't know this. It's very difficult to find that in the explanation of, it's probably in the explanation of coverage, but like in the, a high level plan summary, it's probably not going to disclose that. And that could have, that's just definitely something you want to consider when you're looking at Medicare Advantage plans. OMA plans work continued. Each plan has a service area. You or provider acting on your behalf can request to see if an item or a service will be covered by the plan in advance. Each plan can charge different out-of-pocket costs and have different rules for how you get the services. These rules can change each year, but they cannot charge more than original Medicare for certain services. And they do have a yearly limit on your out-of-pocket costs for medical services. To be eligible, you must have your Part A and B in place, live in the plan's service area, be a U.S. citizen, not be incarcerated, not have, in most cases, not have end-stage renal disease. To join, you must provide necessary information to the plan, follow the plan's rules, only belong to one plan at a time. Oh, another little thing, not in my notes here, you cannot have a Medicare supplement and a Medicare Advantage plan at the same time. Absolutely not. Okay, this slide here is about open enrollment. We're almost done here, but this is a super important point here. This is the time of year when you hear all the commercials, all the insurance carriers are advertising about their Medicare Advantage plan. This is when people can make changes. It goes from October 15th through December 7th. Just a note, this period does not apply to Medicare supplement plans. A lot of people think that it does. It does not. It only applies to Medicare Advantage and prescription drug plans. Any changes that are made during this period each year, the new plan will take effect January 1st. So this is a time that you can review health and drug plan choices. People can join, switch, or drop their Medicare Advantage plan, Part D plan, or return to original Medicare. And there's a note here in bold, it's really important, a whole bunch of asterisks. In early October each year, your insurance carrier will mail you an annual notice of changes booklet, also known as the ANOC. So you want to definitely review that booklet. People who are on Part D plans, if they do not look at this booklet, they don't look at anything during open enrollment, unfortunately, they can be in for an unpleasant surprise. Many people will get the plan premium increase come January 1. And unfortunately, at that time, we're in lock-in. You can't change at that time. It's very disappointing. Many times also, there can be drug tier level changes for the new year, and the cost of someone's refills may go up. Another reason, super, super important for people to review that annual notices of changes booklet. It's going to come in early October. One of my number one tips, insurance tips, is read the mail from your insurance carrier. So coverage begins January 1st. There are no new late enrollment penalties because you must already be enrolled in Medicare. So there was another new thing. This was in 2019 called the Medicare Advantage Open Enrollment Period. This is new, starts January 1st, ends March 31st. This is kind of a last chance opportunity. If someone enrolled in a Medicare Advantage plan and let's say they have some experience with the plan in January and they're not happy, they want to go back or they want to change one more time. Well, they have one last chance to do that. And that's during the Medicare Advantage open enrollment period. It goes from January 1st until March 31st. During this time, you can switch Medicare Advantage plans. You can drop a Medicare Advantage plan and return to original Medicare. And if someone does that, they can enroll in a Part D plan. However, you can't change a Part D plan if you're on a Medicare Supplement plan. And unfortunately, you can't just change Part D. It has to be connected somehow to Medicare Advantage. During this time, you will not have guaranteed issue for a Medigap policy, and also does not apply to Medicare savings accounts or cost plans. All right, one of the last little helpful tips here. This is the Medicare What's Covered app. It's Medicare's free app. You can get it in the App Store or Google Play. Accurate cost, coverage, and eligibility information right on your smartphone for items and services covered by Medicare Part A and B. It's available even when you're offline. Super handy to check and see if something is covered by Medicare or is not. So there's lots of subtopics related to Medicare, and definitely did not have time to go over everything today. There's more things related to VA coverage in Medicare, Medicare and other insurance, Medi-Cal and extra help. By the way, some people ask the difference between Medicare and Medi-Cal. Medicare is for people usually 65 and older, partially subsidized health insurance coverage for those individuals. Medi-Cal is California's version of Medicaid. It's help for people with lower incomes. And we also did not cover anything with regard to Cover California and Medicare. That's a whole nother thing as well. But if you have additional questions, of course, you can reach out to me. In summary, Medicare is a health insurance program. It does not cover all of your healthcare costs. You have choices in how you get coverage. Decisions affect the type of coverage you get. Certain decisions are time sensitive, and we're here to answer questions and provide help if you need it. I've listed my contact here. You can call, email, text. Happy to help anyone with any questions that they have. And I'm also happy to provide all or part of the slides from today's presentation. And I'll go ahead and open it up for questions if anyone has any questions.
Christine, if you could send the slide deck, that would be great.
I will.
Good.
Definitely.
Wonderful. A lot of stuff there.
Lots of information.
Yeah, thank you. I was stuck on just seeing that first slide the whole time. So
You want all of it, or
unfortunately,
you just want some of it?
so thank you.
Oh, you're welcome. Okay, well, I'll wrap it up if there aren't any other questions.
Well, good.
Guys,
Thanks a lot. Appreciate it.
later.
Bye-bye.